Tagunikar, who has spoken on the National Nutrition Survey. Then we have also Dr. Imelda Agdepa, who has spoken on the state of nutrition of the Filipino child. And the last is Dr. Azucena Dayang Hirang, who has spoken on the updates of the Philippine Plan of Action with focus on children under 5. So welcome po. Okay. At this point, we'd like to acknowledge uh, persons from Department of Health. Would like to welcome from the Family Health Office and Women and Health and Men's Health Development Division. Would like to welcome Dr. Maria Wilda Silva, Ma'am Dulcie Alpha, Miss Abigail Monte de Ramos, Miss Hazel Chua, Miss Carla Jean Barte. From the FNRA DOST, would like also to welcome Dr. Anthony Calibo. At this point, we will now be stating some of the questions or saying some of the questions addressed to our panelists. The, the first question is addressed to Ma'am Luz Tagunikar. From Meds Villanueva, Jos Mabalos po Foundations, they have recognized that this campaign is good, but they have also, what about children with cataract cases? This program might be considered too. And also same person, uh, Med Villanueva also said or asked, we have children with cleft and true cleft palate, and truly the campaign has made many parents want to have prenatal medications. So how they can proceed with this? Mom Luz, are you still there?
Okay. Yes. Good morning, and thank you for that question. No. So the Family Health Development Office of the Department of Health is actually focused on the prevention. That's why we have vitamin A supplementation. But if indeed there's a problem like stereoptomia, and in this case cataract, there's another office in the Department of Health that caters to the sick individual. Because the family health is just implementing promotive and preventive strategies. But we have a group in the non-communicable disease uh, group where they look at the eyesight, no? So sight prevention program of the Department of Health. So there's another office taking care of that when there's already a situation where the child is already cataract, no? So, yon. And then for birth defects, that's why we have also the iron and folic acid supplementation, as well as now, together with vitamin angels, we will be doing an operation research on the introduction of multiple micronutrient supplements for pregnant women, precisely to prevent birth defects, no? So, if there's a cleft palate, there's difficulty also in feeding, and the child is more at risk of multiple micronutrient deficiency. No, so that's why mother should be counseled on how to deal with this kind of deficiency. So, as I have said, we are more focused on the prevention of this illness or these conditions to happen. But if indeed this happens, there's another group that takes care of this kind of problem. No? So we are open to partner with non-government organizations also to help them deal with this kind of problem. No? If they see this to with their clients, then they can refer you to the health facility for proper counseling of parents. because a cleft palate child needs some help when it comes to breastfeeding and normal feeding of the child and giving of complementary feeding because there are some conditions that need to be taken care of so that the child will not have difficulty also feeding with cleft palate. Thank you.
Thank you po, Ma'am Luz. Okay. Now the next question uh, addressed to Dr. Agdepa from the Assisi Development Foundation from Ma'am Majin Gutana. How about the 2020 data? Uh, Perhaps the data would be worse because of the pandemic. Dr. Agdepa could react on this, please.
Yes, good morning. Actually, our 2020 data was not actually, the data collection for the 2020 data was not did not push through. It's just because of the pandemic. However, it being one of the mandate to conduct the National Nutrition Survey, we actually resorted to the Rapid Nutritional Assessment Survey. So that means to say it was not really intended to actually reflect or make an inference of the whole population, but since it is actually a rapid survey, so it will just reflect somewhat a characteristic or a description of the areas that were actually covered. So we still do not have the 2020 data. However, we are planning to collect those data this year. Hopefully, our situation will be relaxed, no? And our field researchers are actually already prepared to cover the remaining 37 provinces that were left behind for the 3-year rolling survey. So for 2018, we have finished the 40 provinces, and
Wow.
we actually revealed already national estimates and the provincial estimates of those provinces covered in 2018. So take note that the data, provincial data, speaks only for that province covered in the 2018. So for the 2019, that was actually the result of our National Nutrition Survey also. And you can, however, the vitamin A, you have seen that it's actually only until 2018 because the 2019 data will be actually presented, hopefully I said June, yeah, right? But we are moving ahead. So it's actually on March 27. So expect from us invitation for you to actually see us virtually and join us in this presentation. So yun po, wala po tayo ng 2020 data. Thank you po.
Thank you, Dr. Agdepa. Uh, uh, Rest assured po, so the partners will be receiving the 2020 data. Uh, Now, the next question is directed to Dr. Diane Hirang. Uh, as partners po, the NGOs, how they can really participate in the National Nutrition Search Center program as NGOs. Can you give how the NGOs or the local private partners can participate in the National Nutrition Center program?
Okay. Yeah, thank you very much for that question. Actually, we have right now a partnership with Pilipinas Contra Gutom, and we have also, before the Pilipinas Contra Gutom, we have also the SUN, the Scaling Up Nutrition Movement, wherein we are inviting various groups, especially from the private sector, who has the love for nutrition, the passion to deliver nutrition programs, to be a member of the Scaling Up Nutrition. Anyway, NNC has convened or established or organized the 4 networks, namely the Civil Society Alliance networks, wherein the uh, ILCAN and all this, yung mga Save the Children, no, they are active members of the network of the civil society. Alliance. And then we have also the donor network, wherein UNICEF is the lead convener. So donors, because they want to, they are our development partners also, together with other UN agencies. And we have what we call the Sun Business Network. This is where our technology, FNRI technology adopters are members, active members of this network, of the business, Scaling Up Nutrition Business Network. And the other one is the Sun Academe Network. So the academic network is composed of schools, colleges, and universities offering nutrition courses, no? So, and related courses. So aside from that, as I mentioned, we have the Pilipinas Contra Gutom. So you just have to be a member of the Pilipinas Contra Gutom movement with Cabinet Secretary Carlo Nograles as their active advisor. So feel free. Even, yeah, we welcome everyone here because, you know, malnutrition is always a multi-causal, multifaceted problem. So we enjoin, or we really invite everybody, especially those NGOs who are based in the LGUs, to be partner of MNC in delivering nutrition services. Thank you.
Salamat po, Dr. Dayang Hirang, for that insightful instruction for all our local partners. Another question to Miss Luz, or Ma'am Luz, from Christine Montilla. Actually, she has two questions. Is food fortification mandatory given the nutritional status of the Philippines? And what are the measures of the government done to ensure fortification available to the market, community acceptance of the fortified food? So perhaps Ma'am Luz could give us insight.
Okay, thank you for the question. We have a mandatory food fortification law mandating fortification of rice with iron, our wheat or the flour with vitamin A and iron, our cooking oil with vitamin A, our sugar with vitamin A also, and of course the salt with iodine, no? And there's another part of the fortification which is voluntary. So the mostly processed food products apply for a voluntary food fortification. So they fortify their food products with vitamin A or with iodine or with iron. So most of the voluntary food products are available in the market. The most compliant in the mandatory food fortification is the flour, no? Because we have only 12 millers and importers of flour. All our flour are imported, but when they arrive in the country, they are being fortified by the flour millers. So they are very compliant with the law. Also, the cooking oil, no? So we can see several brands of cooking oil. Yung merong diamond seal, which is uh, the seal of the acceptance of the Department of Health as fortified with vitamin A, no? So they just have to look at the seal of Sangkap Pinoy for those products so that they will be assured that they are really fortified food products. For rice, we have some difficulty because we have around 15,000 millers around the country, and some of them are really small farmers or individual farmers. So it's very difficult to monitor. But we're now concentrating on the use of iron fortified rice in our social safety net programs or the feeding programs, no? So for DepEd, DSWD, feeding in daycare centers, and now the Toto Kainan of the NNC, we're now trying to secure iron fortified rice. So we have producers of the premix now in the country, and the National Nutrition Council being the convener of the group or the technical working group on food fortification is also having negotiation with the Department of Agriculture to really help the National Food Authority, which is mandated by law to lead rice fortification, to actually provide some funds and technical assistance to the NFA to be able to fulfill its role. No, so we have actually NFA have mixing equipment already, and we have producers of premix. So we are working on this, and at least for the social safety net programs, they are being used. For sugar, there's a difficulty really in implementing this as the technology is not very much acceptable. And for salt, in the last National Nutrition Survey, uh, we have only about around 25% adequately iodized salt, no? So maraming iodized salt in the market, um, assuming to be iodized, but when they are tested, around only 25% of those are really compliant with the standards, no? Of we are recommending the 70 parts per million level of fortification so that when it reach the household level, we have at least 15 parts per million at the household level. But the National Nutrition Survey is saying that mostly the fortified salt is reaching the household at the level of 5%, 5 to 10 parts per million, which is below the 15 parts per million recommendation. There are a lot of problems also for food fortification, but there are some gains, and we are really working hard for the implementation. I think the group that has the police power to implement this is the Food and Drug Administration. But with the Food and Drug Administration having a full hand now in reviewing the COVID vaccines and COVID-related medications, the difficulty is that fortified food products is not in their risk list of risk foods to be monitored, because they said no one will die whether they are fortified or not. But in the latest negotiation with them, they agreed that it will be part of their post-marketing monitoring. So they're getting samples of the fortified food products in the market, and they are actually reporting in their website those that are compliant and non-compliant. So that's
Thank
it.
you.
Thank you.
Thank you, Dr. Luz. Uh, we have question directed to Dr. Agdepa from the MPF from Med Villanueva. Considering the increase of poverty concerns due to pandemic, will you reduce your targets? And what percentage of the children or children with disability? Can you give an insight on this, ma'am?
I think Executive Director Dayang Hiran will be answering the
Oh,
targets
okay.
because that's actually the target for the PPAN. But for the National Nutrition Survey to be covering the persons with disabilities, I think we don't have much data on that. Although if you really want a data, let's maybe we can take a look on those raw data that we have if we have children whom we have surveyed with disability. So actually, it's not actually a more focused on disability, but if we encounter households with children with a disability or parents with disability, it is actually noted in our forms or in the questionnaire. Thank you.
Thank you for the assurance, ma'am. Okay, may we call on also Dr. Dayang Hirang to comment on this, particularly on the targets, considering that the increase of the pandemic and increase of poverty.
Okay.
So,
But before the adjustments of the targets of PPAN, I'd like to go back with the question on food fortification. So,
okay, ma'am.
NNC, together with other agencies, will actually will advocate for the consumption of fortified foods and in making these foods available in the market. Okay, this is the reason why that NNC is actually targeting the FNRI adopters in as our suppliers for our food that will be distributed in our dietary supplementation program. But aside from this, we are really putting our plan to convene the TWG and to draft, to lead into drafting of the strategic plan of action for mandatory food fortification in the Philippines. So as regards to data on the acceptance, market acceptance of fortified products, well, there is no data from NNS on the acceptance, but in terms of consumption, we actually have 5% of households consuming processed products with Sangkap Pinoy Seal. No? Ano itong Sangkap Pinoy Seal? Tagal na ito, even when I was still in the LGU, no, as provincial health officer. Itong Sangkap Pinoy Seal is a seal given to the processed foods who are fortified according to standards of the Department of Health, no, in 2015. So across the regions, CAR, or the Cordillera Administrative Region, exhibited the highest proportion of households at 14.8%, while BARM registered the lowest of consumption of fortified products at 2%. So, yun. And I'd like to go back with the readjustments or recalibration of PPAN targets. Well, last February, actually, we finished the updating of the Philippine Development Plan targets. And yes, definitely, because of the effects of the COVID-19 pandemics, imbes na 21% yung target natin in 2022 in with the reduction of stunting among under 5, na-readjust namin to the pre-COVID target of 28%. So that sounds fair because you know what, talagang ang grabe ang effect ng COVID-19 in terms of hunger and malnutrition. So, yun. And the rest, wala naman tayong problema so much with wasting. Still, same lang yung target. But only, ang number one lang talaga natin calibrated is yung target on stunting among under 5 children. Thank you.
Thank you, Dr. Agdepa and Dr. Dayang Hirat. We have 2 or 3 questions. One question now addressed to, I think, Ma'am Luz. You can answer this. Which of the provinces in the country, based on the survey, has the worst problem on malnutrition, and how do you will address this? Ma'am Luz, which of the
Yes,
province?
actually we have identified, yes. Uh, okay. So I don't want to mention specific provinces, but mostly provinces in regions 8, Maropa, the BARM region, region 5, and region 8, those that are prone to disasters and emergencies are the areas mostly affected by malnutrition. No? So all forms of malnutrition, whether stunting, wasting, and micronutrient deficiency. And Dr. Agdepa could also validate as part of their National Nutrition Survey specific, there's actually the survey is not yet complete as there are still about 37 provinces that has not been collected data, no? So we cannot really actually run a comparative analysis of all provinces. But at least for the regional level, we can see that those regions have actually higher prevalence of malnutrition compared to other regions. And of course, in the selection of provinces and regions to be focused on our specific programs, the one that has been cited by Director Dayang Hirang as part of the PPAN, the DOH-led nutrition-specific interventions are focused on these areas. But although these are priority areas, as Department of Health, we are covering all the regions in the country, no? So we're just focusing some of our like tracking and monitoring in these areas as we contribute to the Philippine Plan of Action for Nutrition targets, no? So they are being prioritized, and especially during disasters and emergencies, we provide additional support to these regions. And many of our programs are actually being focused, especially management of wasting, micronutrient deficiency. But as I have said, although there's a special focus in these regions, we are not neglecting the other regions, because the mandate of the Department of Health is that we will take care of the health of all Filipinos and no one should be left behind. Thank you.
No, no Filipino will be left behind. No, napakaganda na po. The next question po, addressed to uh, Dr. Agdepa. You mentioned about P49 and what programs would be included in that P49 and what will be the implication of this as we implement this program.
I think P49, I think that's actually the cause of no, interventions, right? If I'm not mistaken. Oh, is the question in the chat box?
Yes, but how did you come with P49 and what programs would be that? Coming from Christine Montilla.
49 pesos. The meaning to say 49.
Apa, the 49 pesos.
Yes.
Apa.
Okay. Actually, the computation, the economic computation of malnutrition in its monetary value is very, very tedious and very complex now. We have employed a lot of statistical programs and statistical values to come up with this economic cost of malnutrition. So if you like further to dig deeper, then we can refer to you our statisticians. Now, it's a very complex one. Now, deriving such data is really very good indicator. So we are saying that if you invest in programs or interventions costing 49 pesos, because we have posted the different programs that are very effective in addressing undernutrition, cost only 49 pesos. And in return of that investment, we are gaining around 528 pesos na return of investment. I think that's 500 plus, no? So yun po yung sinasabi ng ating datos. That's how we interpret the economic cost of hunger. So for
Christine po yan.
For Christine,
Yeah.
if you like to dig deeper, then you can connect with the Save the Children, also with the FNRI. Thank you.
Okay, thank you po, Director Agdepa. Okay, at this point po, this question is coming from Dr. Apet, no? Why is vitamin A supplementation coverage for only for 6 to 11 months? Can we further extend it or more than 100%? So perhaps this question can be addressed, insights coming from Dr. Agdepa, Dr. Ma'am Luz, or even Dr. Dayang Hira, anyone from the group. Or the survey, yes, Ma'am Luz.
Ay, yeah. Uh, for vitamin A, the 6 to 11 months, as I have said, has a high coverage because we only give one dose in a year. But children 12 to 59 months old are given two doses, no, every 6 months. So the difficulty is that many are given the first dose, but when the second dose comes after 6 months, many of them are either they have transferred residence, or if they're given during summer, no? But usually April and October is the time for giving vitamin A. So if they're just having a vacation on that particular area, and when October comes, they already move out of the area. Some of them are not really given the second dose. And if the dose is not complete, the two doses is not complete, they cannot be reported as an accomplishment. That's why we assume that the first dose is high because in the past, if we request them to submit the first dose, it's as high also as the 6 to 11 months, no? But it's the second dose that is having problem because many of these children are now either transferred or move out of their previous residence, or there are so many other factors, no, that make them inaccessible to the second dose. So the 59% is actually for those who have completed two doses. So probably some of them are not given the first dose but only given the second dose. So, but we are providing complete supply or complete requirements for two doses of vitamin A. I think the problem is that we shift from the campaign mode of April, October GP week, because in the past years we have what we call the GP week. So within that week, they would go outside the actually the healthcare providers and the community volunteers, the BHW, the BNS, would go out and really provide or administer the vitamin A to children um, every April and October. So in sometime in 2014, we shifted our strategy from a campaign mode because very resource heavy yung campaign mode. You need to provide mobilization fund to the healthcare providers, and you need a lot of volunteers if it is always on a campaign mode. And also, the reason for the shift is that, for example, the child visited the health center in January and they are already eligible to be given vitamin A. But if there's GP, they have to wait for April to be able to provide the vitamin A. So there's already 3 months that the child is unprotected, where in fact they can already be given or administered. But I think right now, with our strategy of integrating all child health services and also integrating services within the first 1,000 days, the universal healthcare is more on the integration rather than really bringing down the programs in silo. No, so now during immunization, they can bring with it vitamin A supplementation, micronutrient powder, and if there's prenatal, then also we have the either MMS or the IFA and some other services for the pregnant. So the strategy now is more on integration. So we would like to see more increase in coverage. And I think the low coverage also, especially now in the pandemic, many of the local health workers are also repurposed to be responders for COVID-19. So we're having a lot of dissemination also, and we issued guidelines that we should ensure that essential routine services should not be discontinued because of the COVID pandemic. And we have outlined strategies also that will help the local health workers improve coverage of these services. So I think that's the strategies. So it's the two doses, the 12 to 59 months, that we're having some problem when it comes to coverage. But those 6 to 11 has a high coverage. So probably the NGOs can also partner with the local government units to ensure that those that they are being outreached by these NGOs could also access the second dose of the vitamin A. So thank you.
Thank you, Ma'am Luz. I would like to acknowledge Dr. Dayan Hirang would like to give insight on this matter. Dr. Dayan Hirang on the 0 to 6.
Ayun.
Yes, on the 0 to 6 po of the giving of this vitamin A. Can we further extend it to beyond 0 to 6?
Um, I not on the vitamin A.
Okay po.
Like to add on the priority provinces.
Okay, sige pa.
This has to be clear to our partners in the field. What are those provinces that are really
Yes, yes.
our services? Now, these provinces are actually labeled as PPAN, HDPRC, or Human Development Poverty Reduction Cluster Areas. And these provinces are identified because of their high poverty incidence and magnitude, high prevalence of stunting, and at the same time, high teenage pregnancy. Actually, we based the data in the 2019 Expanded National Nutrition Survey. So the first priority provinces are the provinces of, ano yung mga priority provinces natin? Camarines Sur, Negros Occidental, Negros Oriental, Bukidnon, and South Cotabato. So, yun yung mga probinsya natin. This is the reason why na ang first priority natin, and Zamboanga del Norte, and ang first priority provinces natin are really the targeted areas for our dietary supplementation program for pregnant, nutritionally at-risk pregnant women. So, sir, very important lang ito kasi I saw a question in the chat box regarding the 49 pesos that was mentioned by Director Dr. Agdepa. Now, with as regards to the Tutukainan Dietary Supplementation Program of the National Nutrition Council, which has just been launched last March 8, ang feeding cost po namin for children is 26 pesos per child plus 3 pesos po ng admin cost. Itong admin cost, nandoon na yung mga cell cards, no, ng mga barangay health workers, barangay nutrition scholars, namin, and then other admin cost, no. So a total of 29 peso per child. So meron na rin tayong cycle menu niyan. If you like, we will share with you the cycle menu of NNC. And then for pregnant women also, our cost is 52 pesos. So may 5 pesos po kaming admin cost, a total of 57 pesos per pregnant woman per day. So meron na rin kaming cycle menu dito. And then para lahat po sama-sama tayo ng pag-implement ng mga programa, especially at the LGU level kasi nandoon naman po yung ating mga malnourished children. So maraming salamat po.
Thank you, Thank you, Dr. Daya Hirang. At this point, perhaps would like to get some inputs from the country director of Vitamin Angels, Dr. Escobil, on is Vitamin Angels covering the priority areas of PPAN? Please give us details on this or insights. Ma'am Luz?
Oh, sorry.
Dr. Escobil, please.
Buti na lang. Thank you, GJ, for that question, and also for Dr. Den here for mentioning the priority areas. Actually, in 2019 and also last year, Vitamin Angels has been trying to really look for program partners that were working in those PPAN priority areas. Because, of course, our model is that it's giving of grants to the non-government organizations, no, and even the local government units, the health offices. So we've been successful in some areas. We're able to cover some of the provinces or municipalities in those provinces that Dr. Dan here mentioned, but there still a lot to be covered. So we're also, I'm glad that it was mentioned by her, because our program partners can also probably consider those priority areas. And also if there are other organizations they know that are operating in those priority areas, then we can also invite them to partner with us.
Thank you, Dr. Escobil. We have one more question. We will be entertaining one more. Um Anyone from the panel could react on this. Vitamin A capsules of a particular brand has been out of stock already in major drugstore and pharmacies. So will vitamin A capsules be accessible even for children who are being seen by private practitioners? So will vitamin A capsules be accessible even for children who are being seen by private practitioners? Anyone from the panel would like to react on this?
Well, yes, from the Department of Health side, we are actually procuring 100% of the requirements for the target eligible population. No? For vitamin A, we ensure that the supply is for 100% of the coverage, whether they are getting consultation from the public health centers or the private sector. The private sector can actually refer them to the public sectors, no? If there's no available preparation in the drugstore. And the government is actually procuring this commodity or sourcing this. Our suppliers are sourcing this commodity outside of the country because local manufacturers cannot really produce this formulation because this is high dose, no? Special formulation. I think those that are mostly available in the drugstores are the low dose, the 10,000 IU, and not the 100,000 IU and the 200,000 IU of vitamin A. So we recognize that vitamin A is a life-saving commodity. So that's why the Department of Health is ensuring 100% supply for those eligible targets, at least the 6 months to 59 months old children. That is 6 months to under 5, no? Under 5 children. So for those consulting in the private sector or being catered by the NGOs, kung wala na silang vitamin A, they can link to the local government units for the supply of this vitamin A. Because from DOH, we deliver this to the regional offices, and then the regional offices deliver them to the provincial offices, and then the provinces allocate them to the municipal health offices. So, ganun po yung flow ng ating delivery of vitamin A.
Thank you, Ma'am Luz. Ma'am Luz would like to clarify: is the procurement 100%, which is being done in 2021? Are we still considering the 100% procurement in 2022, since the planning will be starting later part of the year?
We have some commodities that we plan to transition to the local
Okay.
government units because of the Mandanas ruling. So we expect an increase, no? We are having a negotiation also with the Department of Budget and Management on which micronutrients or some food commodities that can be transitioned. So we have identified actually the iron and folic acid supplements, as well as the micronutrient powder, but not vitamin A,
Okay.
because we know that these are being sourced outside of the country, and this is a life-saving commodity, and we cannot rely on the capability of the LGUs to buy for these commodities. So this is one of the few commodities that will be retained at the central procurement level.
Thank you, Ma'am Luz. Uh, as much as we want to continue, please rest assured that all questions have been posted the organizing committee is trying to document, and this recorded Zoom, and I will try to come back to you and answer all of your questions after this meeting. At this point, we'd like to request Dr. Dayan Hirang, Dr. Agdepa to please be on screen as I would like to. Okay, Ma'am Luz Tagunikar, Dr. Dayang Hirang, Azucena Dayang Hirang, and Dr. Imelda Agdepa, on behalf of the Vitamin Angels, would like to thank you for your participation in this wonderful day and for the wonderful insights that you have given to us and to all our partners under the Vitamin Angels supplementation program. So maraming salamat po.